I'm Stephen LeBlanc from the University of Guelph. I'd like to share a summary of the results of a recent trial that we did to assess the effects of SoyChlor on health, production, and reproduction in transition dairy cows. This was the doctoral research project of Rita Couto-Sereno. We know that subclinical and clinical hypocalcemia are really common problems and potentially quite important problems. Certainly milk fever can be devastating to a cow's future prospects, production, and culling risk. But that's the tip of the iceberg for other problems of subclinical hypocalcemia. And although this is a well-known problem with a number of possible treatments and preventive tools, there's still a fair bit that we don't understand, or even that's controversial, about how best to prevent the problem, or even how to classify it in the most accurate and meaningful way. One of the important tools in the toolkit for prevention through dietary intervention is to feed a diet in the last 3 weeks at least before calving that has a negative cation-anion difference. Essentially, you're trying to bring more negatively charged electrolytes, in particular chloride, to the dietary nutrient balance. And the effect of this negative DCAD diet is to induce a very slight compensated metabolic acidosis in the cow, which in turn, through a number of mechanisms, allows the cow to respond more quickly and more effectively to the drop in blood calcium that will inevitably happen after calving. This drop in blood calcium is probably not a bad thing as long as it's not excessive, and the recovery from it seems to be one of the most important things. Negative DCAD diets are not new, but what was new about this study was to do it on a scale and in a number of commercial farms that would allow us to really look at the effects on health, production, and reproduction in one study. So we set this up on 4 commercial dairy farms in southwestern Ontario. Each of them had 1 pen for close-up dry cows, and they were alternated back and forth randomly within a farm from treatment, which was feeding SoyChlor at a level to produce a urine pH between 6 and 6.5, which was our target, or fed a placebo supplement, which was otherwise equivalent, but had a positive DCAD, low positive DCAD of around plus 100 in the diet. So within each farm, they were randomized to be on treatment or control for periods of 3 months, and then switched to the other group, and switched again, and switched again, such that each farm had 2 replicates of each treatment over the course of a year. On one farm, when we switched them from the treatment to the control, they experienced an outbreak of transition cow health problems, including milk fever. And so for cow welfare and farm economics reasons, we cut that control period short and then flipped them back to the treatment, which gave us slightly imbalanced numbers. But in fact, when we did all the analyses with or without that farm in, the results and the directions were all the same. So we're showing you here the full data. So we collected a lot of data with weekly visits by our research team to each of these 4 farms. So the cows were on their treatment or their control diet for at least 3 weeks in the close-up dry period, and we monitored urine pHs weekly to ensure that they were getting the appropriate amount of treatment. Between our team and the producers, we kept track of all the usual transition cow diseases and prospectively measured for ketosis with blood tests and for purulent vaginal discharge with the Metricheck device. In a subset of animals, we did blood sampling on a daily basis to look at blood calcium levels. We followed culling in early and in fact through the whole lactation. The herds were on DHI, and we looked at their milk production for the first 3 tests of the lactation, and also followed their reproductive performance at first insemination and all the way through the lactation. So each farm had 4 treatment periods back and forth between treatment and control. And in the end, we had over 1,000 cows across the 4 farms who contributed to the 15 experimental pen-level experimental units for analysis of this study. We achieved our goal in terms of urine pH, acidifying the cows to a urine pH on average of 6.3. The vast majority of cows were indeed acidified with a urine pH less than 7, and most down below 6.5, which was exactly our target. Body condition score was moderate, with about 30% of the cows being what we consider to be over-conditioned at calving with a body score of 3.75 or greater, and that was equivalent between the 2 treatment groups. In terms of results, the blood calcium was, of course, different in the older cows versus younger cows. So multiparous cows are those in their 2nd lactation or greater. They're the ones at greater risk of hypocalcemia. And you can see that those that received the treatment had significantly higher blood calcium levels all the way through days 1 through 4 postpartum. So they calved at a higher blood calcium level and increase their blood calcium more quickly than the cows in the control group. In the cows in 1st lactation, of course, their blood calcium levels were higher on average, but again, they were slightly higher again in the treatment group. So that if we classified the cows as having a subclinical hypocalcemia with our today's best threshold, which is blood calcium less than 2.15 millimoles per liter, there were significant differences in a lower proportion of cows with hypocalcemia on day 1 and day 2 after calving in the multiparous cows. There weren't differences in the 1st lactation animals, but as you can see, the prevalence of hypocalcemia as expected in those 1st calvers was much, much lower in any case. In terms of health outcomes, we looked at all of the usual transition cow diseases, obviously starting with milk fever. Of course, there were no milk fever cases in the 1st calvers. If we looked overall in the 2nd and greater lactation animals, across the board, there was 7% milk fever in the control group and only 2% milk fever in the treatment cows. And in fact, that was really driven by a difference in the over-conditioned cows. So cows in their 2nd or greater lactation that calved at a body score of 375 or greater, those cows in the control group had a milk fever incidence of 13%, whereas in the treatment group it was less than 2%. There was the same direction in cows calving in moderate body condition, but not a significant difference because the overall numbers were that much lower. In terms of metabolic and uterine disease, there was no difference between the groups in the prevalence or the cumulative incidence of ketosis through the first 2 weeks postpartum. Similarly, there was no difference between the treatment groups in terms of the number or percentage of cows with retained placenta, with metritis, or with purulent vaginal discharge at 5 weeks postpartum. However, we did see benefits with other diseases. So there was a significant decrease in the proportion of cows with displaced abomasum, essentially a reduction by half. So 3.6% in the control group and only 1.7% in the treatment group. And similarly, a tendency for clinical mastitis incidence to be reduced to less than 2% in the treatment group versus over 4% in the control group. If we looked at the cumulative incidence of disease, there was no difference between the groups in terms of having 1 or more disease event. But when we looked at having 2 or more disease events through the transition period, again, we saw a difference between the younger and older cows. So no significant difference in the 1st calvers, but in the multiparous cows, there was a significant reduction in the percentage of animals with multiple diseases, 14% in the treated group and over 22% in the control group. So to summarize, the cows that were fed the negative DCAD diet for 3 weeks before calving had a decreased incidence of DA and tended to have a decreased incidence of clinical mastitis. In the multiparous cows, they had a decrease in the incidence of milk fever, driven especially by overconditioned cows, and again, were less likely to have multiple diseases. We didn't find differences between treatment groups in retained placenta, metritis, ketosis, or purulent vaginal discharge. Going to reproductive outcomes, looking at first service pregnancy risk, again, we saw a difference between the older cows and the first calvers, with treatment effects going in opposite directions. So in the multiparous cows, pregnancy at first insemination was significantly better in the treatment group at 42% pregnant to first service versus only 32% pregnant at first service in the control group. In the first lactation animals, there was no significant difference between the groups, although the direction was leaning the other way. And so when we followed the cows through the entire lactation, again, for the multiparous cows, their reproductive performance tended to be better. That's to say they had a greater pregnancy rate, so that their median time to pregnancy, the time it took for half the cows to be pregnant, tended to be reduced by 11 days. Conversely, in the first lactation animals, unexpectedly, their pregnancy rate was actually lower or worse, such that the cows in the control group half of them were pregnant about 21 days sooner than the cows in the treatment group. And we don't really understand what the mechanism is for this, given a lack of any other differences in health outcomes. Moving finally to milk production, again, obviously older cows make more milk than first calvers, and accounting for differences in fat percentage and protein percentage, we found that the multiparous cows that received the SoyChlor treatment as a close-up dry cow produced more energy-corrected milk at their first DHI test. So they were producing 2.3 kilos more energy-corrected milk at first test. There were no differences, no significant differences between the treatment groups in the first calvers. And finally, for culling risk, again, as in other results, we saw a difference between the first calvers and the older cows, such that there was no difference in full lactation culling in the first lactation animals, but a significant reduction in full lactation culling in the multiparous cows, 21% in the treatment group versus 32% in the control group. And that's illustrated here, that the multiparous cows are being culled at a lesser rate and a lesser cumulative proportion in the treated cows among multiparous animals, whereas in the first calvers there was no difference. So to summarize, we did one of the largest studies to date and did it in commercial herds, ran it over 1 year. We were able to produce the target acidification using the negative DCAD diet fed in the close-up dry period to a urine pH between 6 and 6.5. And doing that decreased the incidence of milk fever, displaced abomasum, and tended to decrease mastitis. There were no effects on ketosis, retained placenta, metritis, or purulent vaginal discharge. In multiparous cows, we improved their blood calcium levels, increased their blood calcium levels in the first 4 days postpartum, and decreased the proportion of cows with subclinical hypocalcemia on days 1 and 2. That resulted in the reduced incidence of milk fever, also increased energy-corrected milk at their first DHI test, improved pregnancy at first insemination, and an improved pregnancy rate throughout the lactation. In the first calvers, there were no differences in blood calcium levels, but again, their prevalence of subclinical hypocalcemia was quite low. No difference in milk production, but the unexpected decrease in pregnancy rate. So to summarize in terms of practical application, we would recommend that this supplement be targeted, if possible, ideally, to animals in their second and greater lactation. However, there may still be benefits to be weighed up if you only have one dry cow group. With that, I'll end on a little bit of shameless self-promotion, that if you're interested in following our research, we have a presence on the web and on social media, and invite you to follow us there to keep up with other research results coming out of our Dairy at Guelph research group. Thanks for your attention.